I like the way you do things here.
Facility's great, staff's great. Dr. Saw really cares, and he's a visionary. And I've wanted to support that. I always wanted to believe that there was somebody out there with the right vision, and I really hope that with all the research he's collecting and patients like me, that we'll be able to help bring this to other people in need, in the U.S. and elsewhere. I'm going to go to Malaysia for surgery because they're in their mind are always thinking the best treatments in the U.S. But the medical system is kind of structured in a certain way, and the only answers I was getting was, hey, you need to get a knee replacement. And when I got here, I couldn't walk across the room, and I was desperate. So very, very pleased with the results, and I would encourage other folks from the United States to kind of think outside the box and outside the system and give it a try. You want the help, otherwise you're going to have to go down the traditional path of knee replacement, and that's going to happen, probably 4 times in your lifetime, and each time you're going to lose function, and I wasn't willing to accept that. I had been through about half a dozen surgeries in the U.S. over the course of 3 or 4 years, and was not really getting the results that I wanted, or hearing what I wanted to hear from the surgeons. And look, I went to really probably the top 5 orthos in the U.S. I had no tibial plateau. There was just nothing there. It was painful, and my tibia had shattered the top of my tibia, and so that's been helped immensely as well. So if you look at the imaging now, you can actually see that it's kind of reformed. Adult stem cell can take the form of really any kind of bone, tissue, cartilage that it needs to, and the goal, particularly in articular cartilage regeneration, is to create some kind of impact spots through the drilling and tell these stem cells where to go. And once they get there, they can figure out, do I need to turn into cartilage, bone, some other tissue? And so that's really innovative in that I think if you were just injecting the cells without kind of triggering an activity, which is what the drilling's for, that it wouldn't be as effective. So that's a key part of the process. It's actually, in terms of cost, been very reasonable in comparison to what I was expecting and what you would find in the U.S. And so that's been a joy. It's just it is a serious commitment to me. And then you're going to Malaysia for medical treatment, but the facility is, once you show up and see it, it's amazing. It has everything that you need here. And there are actually 2 facilities now, right where you can reside, right where the physio is, so that's pretty cool. And Kuala Lumpur is, there's everything that you need available here. There's good transportation, good hotels, all the necessities, right? And if you want to get away for a weekend, there are places that you can go depending on how you're feeling. So, it's not a place to be fearful of coming. It's a significant city here. But here 2 years later, I'm able to walk and ride a bike and do things that I wouldn't have thought I could do a couple of years ago. I'm very excited to get the results that I've heard here from the scan that I had last week, and this possibly be my last set of jabs here today. But the facility's great, staff's great. Dr. Saw really cares, and he's a visionary. And I wanted to support that. I always wanted to believe that there was somebody out there with the right vision. Amazing results, absolutely.
Hello, I'm Maxim, 33 years old. I came from Moscow to be treated here by Dr. Saul. At the moment I have grade 4 lesions, cartilage lesions in my left knee. Also my ACL is partially torn. Also lateral meniscus is almost completely removed. So my story is kind of common. First trauma was 14 years ago, partly torn ACL, meniscus, and probably 1 more ligament, a little bit torn. After that I had arthroscopy in Moscow. They removed damaged parts of ACL, also they removed the damaged part of meniscus. But I continued to do sports, including high-impact sports like basketball, football, volleyball, everything. I was quite a sporty guy. After that, second trauma happened to me like 10 years ago. I was playing soccer, and I turned my meniscus again. Same in left knee, lateral meniscus. I started to search what to do because I couldn't walk normally. So actually I did my own research, very big research through internet. So suddenly I found this place and this method, and I decided to come here. This method is like this. Stem cells are extracted from your own blood, and they're kind of fuel for cartilage regeneration. So this booster, combined with traditional method of microfracture and also very intensive physiotherapy after surgery, helps to activate our body's natural mechanism of tissue regrowth, and it helps to regenerate not the fibrous but hyaline-like cartilage, which is kind of the same or similar to the cartilage that we initially have in our body. In my case, Dr. So made surgery. He removed damaged cartilage, which I had. Then he made microfracture. Also, he fixed some other things that accompanied my knee problems, because I had arthrosis for so many years. Once the operation is done, probably 6 days after surgery, my own stem cells, was extracted from my blood during the special harvesting procedure. After that, stem cells was injected to my knee once per week. In total, 5 injections. What can I say about this clinic? I feel here very comfortable. Everything is made in high professional level, like world-class level. So all the treatment, even the small details, they think about everything. Yeah, that's right. So you don't have to worry about anything. Everything is provided here. Also, atmosphere is very friendly. Everybody laughs here, smiling. So that makes sense, because it's also very important. So at the moment I feel very positive and optimistic, really. And no doubts I will recommend this to my friends, to anybody actually, because there is the only option that can help you with your cartilage at the moment. So I hope this method will someday conquer the world, really. So thanks to Dr. Sol and to all his team.
My name is Phil Fang. I'm 50 years old. I lived in the United States, in New York. It's been about 1.5 years since my right knee surgery, but with Dr. Sol. And I can tell you, it's been night and day. As I will always tell my friends and my family, anybody who asks me, Dr. Sol has changed my life, much, much better. Basically, after my surgery in the United States, my doctor basically just shook his head and just gave me a steroid shot and some hyaluronic acid. And basically, I was just waiting for the inevitable of knee replacement. I do not want to accept that. Therefore, what I did is I started doing research online. And eventually, I found Dr. Sol. And from what I saw, what Dr. Sol was doing was very innovative. Basically, he's using articular stem cell regeneration, cartilage regeneration, to rebuild your knee cartilage. And that is when I looked into it even more. What it is that in most normal person, once you damage your cartilage, it will not regrow back because there's lack of blood supply. And what Dr. Sol's innovation technique does that he will allow the blood to seep up and give you a better blood supplies. On top of that, he will use your own stem cell to almost act as a fertilizer to help the cartilage grow into the type 2 hyaline type cartilage that is actually much stronger and almost like the original cartilage that you would have. And I can tell you, since my surgery, it's almost like I have a brand new set of knee cartilage on my right knee. Since my surgery, I had to stay in Kuala Lumpur for 6 weeks also not just for the stem cell treatment, but also for physiotherapy. I think that's actually one of the key components of part of Dr. Saw's method to rehabilitate your articular knee cartilage. What it is, he's always told me that it's not just using the stem cell to rebuild your knee, but you also the physiotherapy and all the exercise protocol that he prescribes would actually help you build the knee. One particular example is the load-bearing exercise that I have to basically do continuously. In fact, even now, I still continue to do the load-bearing and still continue to do the swimming and the cycling and all of that in combination with the stem cell booster shot that I come back every 3 months and now every 6 months. It continued to grow my knee cartilage. It could grow up to 4 years, as according to Dr. Saw. So I think it has been a great experience for me to come to Malaysia and see Dr. Saw.